Hi guys, it's Kelly. I'm at work and there are people cleaning the carpets out in the hallway, so sorry if there's a lot of vacuum going on, but I'm trying out my new microphone. Might start doing podcasts for 2020 because I'm bored. I feel like I'm having the 7-year itch in my career right now. So there's that. So today we're going to talk about sex, so it'd be fun if some people came on and asked questions, but it's Saturday, so do your thing. So we want to talk about sex, we want to talk about postmenopausal sex. Hi Jenny, thanks for watching. I am a urologist, so we've been doing Viagra for decades now. Viagra came out in the early 80s, over the counter in many, many countries. And has anybody ever thought about who these people taking Viagra are sleeping with? No. So there's been no FDA-approved medications for female desire or sex. Hey Danielle, hey Kim. Until 2019. So 2020, you're probably going to see a lot of advertisements for hypoactive sexual desire disorder or low libido. So the question is, do we have to take medications to have sex? Depends upon who you ask. I think a lot of low libido and desire is society's way of just the way we were taught. Hey Lauren, hey Jane, about sex. So number one reason that women see a doctor for sex drive is they have low sex drive or low desire, or officially hypoactive sexual desire disorder, which in itself is not a sexy thing to say. So education goes a long way. So number one is the difference between reactive and spontaneous desire. And this is huge, and this is very normalizing for many people. So spontaneous desire is what Hollywood is. It's the woman getting super turned on and the penis goes in the vagina and they have an orgasm. And they just want to sleep with anybody because they're 18, and that's spontaneous desire. So what happens as we get older, especially postmenopausal, is we have reactive desire. Completely normal. Okay, that does not mean you're broken. And this is what's so empowering about just basic sex education knowledge that nobody got in elementary school. I didn't get in medical school, which is a whole another interesting story. So responsive desire. Responsive desire is normal. It is the majority, and there's nothing broken with you. So responsive desire is, I'm sitting on the couch, I had a long day at work, I just did the dishes, I've got something to think about tomorrow at work, but my partner comes up, he's looking pretty good, he thinks that, you know, maybe we should have some sexy time, and he starts getting me in the mood, and then I get to the party, and it's a good party. So we'll use that for an analogy. But responsive desire is, I was not in the mood. I was not thinking about sex, but I got stimulated. I surrounded myself with the opportunity for sex, and then I was able to have satisfaction and orgasm. That is responsive desire. I have fixed a bunch of people's low libido by just knowing that that is normal. So you actually have to kind of get into the game of sex, and the thing with the mind is our Western mind of like go, do, plan tomorrow, all that stuff. That's not good for sex. So you really have to work on the mindfulness and turning it off, and then just enjoying being at the party. And a lot of women, they're at the party and they have a good time and they have an orgasm and they're like, yeah, but I don't just spontaneously desire it. That is okay. That is normal, and that's not something to be fixed. You're not broken. Stop listening to Hollywood. So that's rule number one. You're not broken if you have responsive desire. It's completely normal, completely appropriate, and yes, you're not 18 and wanting to like jump everybody in the hallway when they're at their lockers, but that's okay. We don't want to be 18 anymore. So I hope it's very normalizing to people. So that's the most simple thing. You don't need to see a doctor if you have responsive desire and you otherwise have great hormone status and you're feeling good. So hey Danielle, you work in the pharmacy. Oh my gosh, I bet you get a lot of Viagra. Like, I need my refill now because it is going to be a Friday night. And yeah, definitely. So feel free to ask questions. I'll make sure that I kind of look. Let me see. Yep, okay, we're good. So number two, let's talk about skincare, because we love talking about skincare because I'm going to take care of my skin today. So skincare in the vulva. And this is really important for perimenopausal, postmenopausal people. So one of the number one complaints with pain with sex is dryness. So this is good too. I spend most of my days when I talk about sex just breaking down the things that society taught us about sex. So number one, yes, you're supposed to use lube. So I had this like 24-year-old the other day. He's like, my boyfriend told me I'm not supposed to use lube. And I'm like, you're supposed to use lube. So you're supposed to use lube. That's normal. It's like 86% of people use lube. It's like a huge industry. So lube is normal. Our body likes lube. So that's okay. Number 2, silicone-based lubrication, especially for perimenopausal and postmenopausal, is very awesome, and that's what I recommend because it doesn't get absorbed with really dry skin, and a lot of vulvas get really dry as the hormones change. So that's easy, non-prescription, don't see a doctor, just try some silicone lube. A really nice silicone lube is Uber Lube, like the car, U-B-E-R, lube. Super clean. Very few ingredients, very little kind of allergic issues with it. So Uber Lube is awesome. You can get on Amazon or uberlube.com. They send me tons of free samples all the time. I'm looking for my samples. So silicone-based lube, especially for dry skin. So this is all skincare. If you think of it like skincare, women are like, ooh, I like skincare. So number 2, and this is prescription, but I love it, and I love it. I'm not giving anybody medical advice. I'm keeping everybody happy. But estrogen, estrase, estradiol, Premarin. There are many. There's also, you can get it compounded if it's cheaper where you are. You do need a prescription for it because it is a hormone. The risk of breast cancer or any other cancer with vaginal estrogen is this number. So it's 0. There's a black box warning saying there's a risk. They've been trying to take that off for about 10 years. So many papers are published saying that the risk of systemic estrogen, especially in the way I prescribe it, which is just very minimal to the vulva, because the vulva is the area that gets very painful and dry. And going back to responsive desire and libido, you do not desire things that are painful. I'm not going to go hit my hand with a hammer because it's painful. I'm going to stay away. I don't want to have sex because it's painful. One of the biggest reasons for pain with sex is skincare, dry vulvas, because it's just more sandpapery and there's friction. The other big reason for pain with sex is improper stimulation. So don't rush to penis and vagina. The vagina actually opens, lengthens, and tilts with female arousal. So if a lot of women say they have pain with penetration, if they're hitting the back of the vagina or they just feel like it's too tight, is proper stimulation to get the pelvis ready for penis and vagina. In my world, we call it PIV sex, which is society's main way of saying that's how we're supposed to have sex. But there are many ways to be intimate with people. That is just one of them. So penis and vagina sex is uncomfortable if the vagina is not ready. So get the vagina ready. Many different ways. The other thing for perimenopausal, postmenopausal is the rule of what worked for you then won't work for you now. Well, when I was 18, like, I just looked at my boyfriend and had an orgasm. Yeah, well, it doesn't work anymore like that. Okay, the hormones change, and you weren't in a committed relationship with a stressful job and 3 kids and a to-do list tomorrow and all the other things that decrease spontaneous desire. So, just because it worked for you when you're 18 does not mean somebody's going to figure out how to make that work for you when you're 52. The other rule for that is clitoral stimulation, vulva stimulation. The clitoris, here's more fun anatomy. The clitoris is this teeny tiny little thing, but actually inside the woman, it looks like a wishbone. So it goes around the labia, which is why the labia can be very stimulating and a nice turn on for lots of women. So the clitoris is here, but inside of you, it's actually all of this. And that needs a lot more attention in order to achieve orgasm. Did you know, here's another fun fact that things society never told you in like 3rd grade sex ed. Less than 20% of women, so less than 1 in 5 will achieve orgasm by penis and vagina sex alone. What? Everybody in Hollywood on the movies has simultaneous orgasms with penis and vagina sex. That's a lie. That's Hollywood. That's not real. So that's the other part of what I love about my job is, like, you are not broken if you can't have an orgasm with penis and vagina sex. So a lot of this is just normalizing, the adult sex ed that we never had. Is don't be afraid of clitoral stimulation, and the clitoris is big and goes all the way around. Vibrators, lubrication, things before the penis. So the penis is actually not all that good for making women have pleasure. So, hey JM, that's my spiel for today. So probably not enough for some of you, probably too much for some of you are like, lady. So that's my job. I'm a urologist who talks to women about achieving their best lives with desire. Really great books to read. Okay, where should you go next? Books to read. It's gonna be 2020. Want to read some books about sex. So Come As You Are is an amazing book talking a lot about responsive desire versus spontaneous desire. The other huge misconception, and it's very common, is desire mismatch. So my partner has a certain level of desire and I have a certain level of desire. And the woman, commonly, gets stressed because she feels that it's her job to rise to match the high desire, typically the man, not always. And it's not your job to match anybody else's desire. They're adults and they can take care of their desire. If they need to have this much amount and you need to have this much amount, they can take care of themselves. You don't need to rise to it. Mind-blowing. I gave this talk in Seattle at a multiple sclerosis society. I got a letter like 2 months later from a doctor, and she's like, you just explained my divorce from 20 years ago that like years of therapy couldn't figure out. It's not your job to match another person's desire level. So freeing. So Come As You Are is super cool. Emily Nagasaki, that's not her real last name, but that's what I'm remembering it as. She's a PhD. She's amazing. The other, Lori Mintz, PhD, Becoming Clitorate. Super amazing as far as techniques for female sexual satisfaction. So those would be my two biggest books. She Comes First would be good for any male that you were going to get more into the conversation with. Another resource, which is awesome, is OMG Yes. So, oh my god, yes. It's like $40 for the basic and like $80 for the more advanced, and it's really science-based female pleasure videos and techniques, because we're not Hollywood. What Ethan Hawke does in the movies with Winona Ryder in Reality Bites when we were 16 and watched it, for all you Gen X's, that's not how the clitoris works. So OMG Yes is amazing, and that would be, if you're going to spend some money besides spending money on lubrication, vaginal estrogen, and a vibrator, it would be OMG Yes, because it's got great videos. I know, Michelle, right? So communicating with your partner is huge. Okay, so I'm not a sex therapist. Sex therapists are amazing, and there's not that many of them, and if anybody's like, what should I do with my life? Please be a sex therapist. You can do very well, and there's a huge need, so be a sex therapist. They're so amazing at normalizing everything. So the really difficult thing is talking to your husband. So stating facts, just being like, did you know that Hollywood completely misrepresents female sexual desire? Just like be very a fact-based person if you are married to a fact-based human. So fact-based stuff, and then just planting little seeds, because men, you need to communicate to somebody who, I'm going to stereotype here, you're going to communicate to somebody who has a ego that is going to be crushed because it's gentle. Here's the thing about men. Men, if you think women have it hard in society with sex, men have it rough too, okay? So hearts out to them. Their whole manlyhood, manliness is wrapped up in their penis. And we're like, and it's huge to them. So if you tell a man that he can't have you orgasm because his penis isn't good at that, like that's probably not, that's like how not to communicate this. Don't do that. So just the kind of little facts of being like, you know what I really like, or you know what I really, did you know that in most heterosexual marriages there's an orgasm discrepancy mismatch, and there isn't in gay relationships? So we put a much bigger priority on male orgasms. They're cleaning my carpets out there, and it's driving me crazy. I hope you can't hear it. We have very clean carpets. So orgasmic discrepancy mismatch is incredibly common because we prioritize male orgasm more than we prioritize women's orgasm. That's bullshit. That's not equality. So just say, you know what, I love being intimate with you, and I want to try some other ways to make sure that I have an orgasm. forgot to paraphrase that because I didn't say that very well. And OMGS actually really is helpful with that. And here's the thing, as far as like trying new techniques, is sex is playful. If you think about sex as adult play, whereas a lot of people think about sex as an adult project. So it's not a project, it's play. It's how adults play. So explore things. Like I am seriously telling you that there are people that get turned on in ways that they never thought they got turned on, or they were like, that's not the right way to get turned on. Girlfriend, there are many different ways to have orgasms. And so it's just, if you go into it with a very playful, open mind and trying new things, think, okay, let's bring it back to working out. Like, I don't like cardio, but I'm like, I know that cardio might be good for me and it might challenge my body. Of like doing that when you go into sex and being like, this isn't working, what else can I do? And to have a mind of playfulness going into it. So, but yeah, the male ego is incredibly fragile. And remember, he was taught to put his penis in the vagina and that you should orgasm with that. But that's not what the data says. That's not how it works. But his ego is really tied up in that fact. So that's kind of, it's kind of a fragile thing. But if you can have the communication of like, to make it more enjoyable for me to be at the party, I like to have orgasms. In order for me to have an orgasm, this has to happen. And just, subtle, just bring it up a little bit, but then back off and like see how it goes. You're not going to be like, I just went to the store and got this new lube and got some estrogen cream and 3 new vibrators and let's party. Like that might not, you might need to go slower than that. So I hope that helps. Yeah, you gotta talk to partners. And if you can't, if you're hitting roadblocks, sex therapists are amazing. And you can meet with sex therapists by yourself, or there's couples sex therapists, because there's not a lot of data on this, but relationships break up because of intimacy. And that's why a lot of people, like, the kids are out of the house and the marriage ends. Intimacy is a huge reason, and a lot of people, especially men people, are very tied up to sex as a way to show intimacy. So this is a legitimate relationship issue for a lot of people, and that's why it's so near and dear to my heart. Because it takes mind work, it takes playfulness, it takes practice, it takes relearning what society put in our head about the importance of female desire, how females achieve orgasm and desire, and kind of all the rules that we learned, and like, and it's the whole equality thing. So like, this is an amazing topic for anybody who doesn't know what they want to do with their life. Sex therapist. So that was probably my longest video ever. Let me know when I'm gonna go take care of some skincare issues now. You know what I'm saying? So I gotta go do that. I love you all. I love this group. Looking forward to awesome things in 2020. I'm really thinking about hammer and chisel because I want to work on some muscles. So I'm going to calculate when 100-day ends in the beginning of January, and then give us like a week off, and we'll pick a start date. So I'll get better with that. So thanks for letting me share. I hope you guys love this. Thanks for watching. 11 people were on, so like maybe we all want to have better sex. That's good. Vulva skincare. All right, all my loves. Love you. Bye-bye.